Bismillahirrahmanirrahim. Assalamu alaikum. A 45-year-old woman come to the emergency department with right upper quadrant pain. The pain started about an hour ago after a large fatty meal and is associated with nausea. The patient had similar episode a week ago that resolved spontaneously. She has no vomiting or diarrhea. The patient had a cholecystectomy 2 years ago due to symptomatic cholelithiasis. Other medical conditions include hyperlipidemia and obesity. The patient does not use tobacco, alcohol, or recreational drugs. Temperature 37, blood pressure is 140/85, and pulse is 110 per minute. Cardiopulmonary examination is unremarkable except for tachycardia. The patient has right upper quadrant tenderness to deep palpation without guarding or about tenderness. Bowel sound are normal. Rectal examination is normal and stool is negative for blood. Laboratory results are as follows: leukocyte 8,000, total bilirubin 1.3, alkaline phosphatase 120, aspartate aminotransferase 37, alanine aminotransferase 49. Abdominal ultrasonography revealed a mildly dilated common bile ducts but no stone. While in the emergency department, the patient received morphine for pain control, but the pain worsened. Which of the following is the most likely diagnosis in this patient? So this patient is 45-year-old woman. She came to the emergency department with right upper quadrant pain. The pain started after a large fatty meal and is associated with nausea. The patient has a history of cholecystectomy 2 years ago. Patient has right upper quadrant tenderness to deep palpation without guarding or rebound tenderness. In emergency department, the patient received morphine for pain control, but the pain worsened. Based on these, here the diagnosis of this question is sphincter of oddi dysfunction. Sphincter of oddi dysfunction, and here the correct option is choice E, sphincter of oddi dysfunction. Why the choice E is the correct one? Because sphincter of oddi dysfunction causes intermittent obstruction of the flow of bile and or pancreatic juices into the duodenum. Affected patient typically experiences recurrent episode of right upper quadrant pain or epigastric pain with elevation in liver function test and or pancreatic enzyme, increased pain after opioid and dilated bile ducts without stone on ultrasonography are classical finding for sphincter of oddi dysfunction. Come to the incorrect one. Bile reflux gastritis. So bile reflux gastritis result in bilious vomiting, frequent heartburn and abdominal pain, and is usually due to pyloric sphincter incompetence due to gastric surgery complication. Choice B, cholelithiasis. So absence of stone on ultrasonography and increased pain after morphine administration makes sphincter of oddi dysfunction likely in this patient. Choice C, chronic mesenteric ischemia. So chronic mesenteric ischemia can present with recurrent postprandial upper abdominal pain. Most patients are aged more than 60, have a history of coronary or peripheral arterial disease, and develop food aversion with significant weight loss. Choice D, irritable bowel syndrome. So patient having irritable bowel syndrome, which is a functional gastric intestinal disorder characterized by recurrent abdominal pain with stool pattern changes. Sometimes the patient will complain of constipation, and sometimes the patient will complain of diarrhea. Thank you.